Hello everyone. So we will be talking about non-insulin diabetic drugs by Emily, Chantal, Linda, and Tara. Diabetes is the most common metabolic disorder. It is characterized by complex disturbances in metabolism. There are two types. There is type 1 and type 2. For this specific project, we will be focusing on type 2 diabetes because it's the only type that responds to oral agents. The patient with type 2 diabetes is able to produce insulin, but not enough to maintain glucose control. Over time, the strain placed on the beta cells by this level of insulin production can destroy them, diminishing insulin production. Type 2 diabetes has a slow and progressive onset. There is also a genetic part that plays in the patho of type 2 diabetes. A diagnostic test for diabetes is the A1C test. This will help us determine the blood glucose levels over the last 3 months. If the levels come out greater than 6.5%, then the patient has diabetes. Some of the signs and symptoms of diabetes are hyperglycemia and hypoglycemia. For hyperglycemia, the fasting blood sugar is greater than 126. The patient will develop tachycardia, hypotension, Kussmaul respirations, fruity breath, weakness, decreased level of consciousness, and glycosuria. Hypoglycemia, the fasting blood sugar is less than 60. The patient's symptoms will mimic the symptoms of alcohol intoxication, such as difficulty speaking, visual disturbances, confusion, weakness, hunger, nausea, and anxiety.
Non-insulin drugs are used to treat type 2 diabetes. These drugs can act in a variety of ways. Either they will decrease insulin resistance or affect insulin release. They also affect the GI tract and the absorption of glucose. And they also affect the release of glucose by the liver. Sulfonylureas are the first oral agent for diabetes type 2. There are two types. There's first and second generation. Both generations are the adjunct to diet and management of type 2 diabetes, as well as could be used as an adjunct to insulin, therefore reducing the insulin dose and decreasing the risk of hypoglycemia. These drugs bind to potassium channels on the B cells in the pancreas, thus improving insulin binding to the receptors and stimulating insulin release. Sulfonylureas are only for patients with functioning beta cells. These drugs, however, will lose effectiveness over time, so you will need constant monitoring. As a reminder, patients should not be taking alcohol while taking any sulfonylureas drug. Caution giving sulfonylureas to patients who have any allergies to sulfa and any patients with type 1 diabetes because they do not have functioning beta cells. These drugs are also not for pregnant or breastfeeding mothers. The adverse effects of sulfonylureas are hypoglycemia, GI distress, allergic skin reactions, such as the picture shown below, and an increased risk of cardiovascular death, especially in the first generation. The first generation of sulfonylureas drug are no longer used because of the increased risk in cardiovascular death. Although if you were to give any, tebutamine is a good choice for patients with renal dysfunction. Sulfonylureas second generation, such as glyburide, have many advantages over the first generation, such as excreted in urine and bile, so they're safer for patients with renal dysfunction, and they do not interact with as many protein-bound drugs. These drugs also have a longer duration, so this will also increase patient compliance. The actions of these drugs are stimulating insulin release from functioning beta cells in the pancreas. This may improve insulin binding to insulin receptor sites or increase the number of insulin receptor sites. The adverse effects of this drug are GI discomfort, anorexia, nausea, vomiting, heartburn, diarrhea, allergic skin reactions, and hypoglycemia.
Other common non-insulin drugs include the categories such as alpha-glucosidase inhibitors, biguanides, DDP4 inhibitors, human amylin, incretin mimetics, GLP-1 agonists, meglitinides, SGL2 inhibitors, and thiazolidinediones. We'll go more in depth into some of these categories in the following slides.
Metformin, also known as glucophage, is a biguanide and is also used as an adjunct to the diet and exercise for the treatment of type 2 diabetes. It's used in people older than 10 years of age. It decreases the production and increases the absorption of glucose. This drug does not cause hypoglycemia, and its major side effect is GI distress. This drug can also be used as a treatment of polycystic ovarian syndrome. Metformin is used in the oral route and is a slow onset with a peak of 2 to 2.5 hours. It lasts for 10 to 16 hours. Glutide, also known as Victoza, is a GLP-1 agonist, meaning that it acts on the beta cells to increase insulin release and decreases glucagon release. It slows GI absorption and decreases appetite. It's used in conjunction with the diet and exercise modifications for adults with type 2 diabetes. It's a subcutaneous injection that's used once a day for 1 week, and then the dose increases after. Side effects include angioedema, anorexia, hypoglycemia, headache, and dizziness. For nursing considerations, you should assess for tumors of the thyroid and assess for hypoglycemia.
This next drug is sitagliptin, which is also known as Januvia. This is a DDP4 inhibitor which promotes glycemic control by enhancing the actions of incretin hormones. It's used in adjunct to treat type 2 diabetes and can be used alone or with pioglitazone or metformin. This drug is given orally, and the most common side effects are upper respiratory infections, hypoglycemia, urinary tract infections, and headache. This drug also slows GI absorption, and all the drug endings are gliptin. This next drug is canagliflozin, also known as Incovana. This is an SGL2 inhibitor, which means it's blocking the reabsorption of filtered glucose in the kidneys, which then leads to glucosuria. This drug is given orally in adjunct to diet and exercise in order to treat type 2 diabetes. It's excreted in the urine and has a rapid onset. Side effects include genital fungal infections in both females and males, urinary tract infections, polyuria, dehydration, and hypotension. Because of these symptoms, it's preferred that these drugs are taken in the morning, and they all end in gliflozin.
Now we're going to do a few review questions. For review question number 1, the question is, how does metformin act in the body? A, increases production of glucose and decreases insulin production. B, increases production of glucose and increases insulin production. C, decreases production and increases absorption of glucose. Or D, increases production and decreases absorption of glucose. The correct answer is C, decreases production and increases absorption of glucose. This makes this drug effective in lowering blood glucose levels and does not cause hypoglycemia as the sulfonylureas do.
For review question number 2, sulfonylureas is only for patients with A. Functioning alpha cells, B. Functioning beta cells, C. Non-functioning alpha cells, or D. Non-functioning beta cells. The correct answer is B. Sulfonylureas is only for patients with functioning beta cells.
Review question number 3. The home health nurse is visiting a client who was recently diagnosed with type 2 diabetes. The client is prescribed repaglinide and metformin and asks the nurse to explain these medications. The nurse should provide which instructions? Select all that apply. 1. Diarrhea may occur secondary to metformin. 2. The repaglinide is not taken if a meal is skipped. 3. The repaglinide is taken 30 minutes before eating. 4. A simple sugar food item is carried and used to treat mild hypoglycemia episodes. 5. Metformin increases hepatic glucose production to prevent hypoglycemia associated with repaglinide. 6. Muscle pain is an expected side effect of metformin and may be treated with acetaminophen, such as Tylenol. Review question number 3. The home health nurse is visiting a client who was recently diagnosed with type 2 diabetes. The client is prescribed repaglinide and metformin and asks the nurse to explain these medications. The nurse should provide which instructions? Select all that apply. 1. Diarrhea may occur secondary to metformin. 2. The repaglinide is not taken if a meal is skipped. 3. The repaglinide is taken 30 minutes before eating. 4. A simple sugar food item is carried and used to treat mild hypoglycemia episodes. 5. Metformin increases hepatic glucose production to prevent hypoglycemia associated with repaglinide. 6. Muscle pain is an expected side effect of metformin and may be treated with acetaminophen, such as Tylenol. The correct answers are 1, 2, 3, and 4.
Review question number 4. Glimepiride, also known as Amaro, is prescribed for a client with diabetes mellitus. The nurse instructs the client to avoid consuming which food while taking this medication? 1. Alcohol, 2. Organ meats, 3. Whole grain cereals, or 4. Carbonated beverages. The answer to number 4 is 1. When combined with alcohol, glimepiride can cause a disulfiram-like reaction.
Review question 5. A patient receives metformin glucophage. What will the best plan of the nurse include with regard to patient education with this drug? Select all that apply. 1. It stimulates the pancreas to produce more insulin. 2. It must be taken with meals. 3. It decreases sugar production in the liver. 4. It inhibits absorption of carbohydrates. Or 5. It reduces insulin resistance. The correct answer to number 5 is 2, 3, and 5. Review question number 6. A doctor has prescribed sulfonylureas for a patient in the management of type 2 diabetes. As a nurse, you know the primary purpose of sulfonylureas, such as long-acting glyburide, is to 1. Induce hypoglycemia by decreasing insulin sensitivity. 2. Improve insulin sensitivity and decrease hyperglycemia. 3. Stimulate the beta cells of the pancreas to secrete insulin. Or 4. Decrease insulin sensitivity by enhancing glucose uptake. The correct answer to number 6 is 3. stimulating the beta cells of the pancreas to secrete insulin. Thank you for listening to our wonderful lecture on non-insulin drugs. Everyone stay positive, we can all do this.